thought it was about the dogs. Nah, it's about power. Yeah. Put up to the specialty, sunrise on the ground. Dogs in the grooming tents, whispers all around. Catalog smiles with the tension in the air. Every handshake got a hidden little snare. Bored in the back room, running quiet little schemes. Bylaws in the pocket like a stack of poker dreams. Slayers for the breed, but they guarding their throne. If you question anything, they coming for your bone. Grievance in the envelope, certified mail. Club justice system, but the day.
Welcome back, everybody. Hope you had a good lunch. If you're new here, welcome. You're returning, welcome back. We're just waiting for them to come back from lunch. Oh, Crystal Pike is challenging The state execution methods. So Crystal Pike is challenging the state's execution method. Lethal injection. Okay. Do you want firing squad instead?
Here to a intermittent or is it constant?
Yeah.
Yes, that could be potentially traumatizing, and Dr. Brand, I think.
She could be potentially traumatizing. Come on, she's going to be lethally injected. So she doesn't want to be. Oh my God. She doesn't want to be observed before she goes getting lethally injected. This doesn't make any sense. What is wrong with the world we live in? I forget what Christa Pike did. Wasn't she? She should have been lethally injected years ago. Pike. How long has she been on death row? Yeah, 1995 murder charge.
Your Honor, for the purpose of the record, we return back to the matter. Commonwealth versus Lindsay Clancy. All parties are present, excluding the jury.
All right, Counsel, could I see it sidebar?
Oh my God. Okay, so Christa Pike, currently the only woman on Tennessee's death row, was convicted of the brutal 1995 murder of her classmate, Colleen Sleemer. Okay. If carried out, her execution will mark the first time a woman has been executed in Tennessee in over 200 years. and only the fourth woman executed in state's history. Pike was 18 at the time of the crime, making her case notable as the only modern-era Tennessee execution for a crime committed at that age. Well, yeah, but yeah, it was brutal if I remember correctly. Yeah, it was stems from a violent attack in which she, along with her boyfriend, Tadrell Ship, and a friend, Shadola Peterson, lured Slemmer to a wooded area in Knoxville, Tennessee. Slemmer was beaten, stabbed, and ultimately killed with a piece of asphalt. Pike reportedly kept a fragment of her victim's skull as a souvenir. Yeah. So she was sentenced to death in 1996, becoming the youngest woman in the U.S. to receive the death sentence at the time. So this is in 1995. So she's been on death row for 31 years. This is the problem with executions. So now she's fighting the execution method because she's going to be held at a man's prison, or she's going to be supervised every 15 minutes prior to be going into a lethal injection chamber. Oh my God, by men. And that could be traumatizing. I don't care. I don't care. Oh my God. This is what's wrong. Do we care? I mean, honestly. Oh, it was brutal. So if you look her up, I believe, actually, if you look her up on YouTube, because I believe that Pierce he went and visited her in prison to talk to her. And they did, but there's a documentary on her. It was brutal. And it was because she was talking to her boyfriend. Or they had like a little fling. And she's a white chick. The tied to Daryl, and it's TadarYl Ship. So he's black. And the other girl, the Slemmer, she's white. And so they were at like this work release halfway house thing. They'd gotten in trouble at school. If I'm remembering all this correctly, they'd gotten in trouble at school. And so they shipped them off to this like halfway house work release thing. Yeah, got the nerve to feel traumatized, right? I will have to look more into that. Yeah, I had not heard of it until now. Right. So let me see. Because I'm pretty sure yes, there's a documentary on it. Yeah, she's on, it was 2 years ago, got 4 million. I'll drop it. There's the link. Yeah, and then she kept a piece of her skull. So there's the link of it. But if you just look her name up, there's a whole bunch of information. Literally horrible. And she was 18. But they had to go to like this halfway house, like work release type thing. And it's like, you get to go there. It's kind of like what judges did instead of like, you know how back in the day, like you had the option, like for boys, go to the military or go to jail. Well, this was like, go do this work release thing, and they teach you like skills and shit like that. She was even bad there. But she like started dating this kid. And either he was flirting with her or they'd broken up, and in between breaking up, he was like flirting with this chick or dating this other chick, and she like lured her. It was stupid. You have to watch it. I'm just trying to go by memory because I watch so many crime things. And I'm trying to remember if that's exactly how that went or if that was just another one. So it's crazy. But yeah, now she doesn't want to. She's trying to appeal the treatment that they get. Like, you're going to be dead. Yeah. So she's supposed to be executed in September, which is why this is all being brought up. And Pike's attorney filed a motion in June challenging the constitutionality of the state's legal injection protocol after the failed execution of Tony Carther, resulting in the Tennessee Supreme Court appointing Senior Judge Mark Ward to oversee the hearing. Because they gave him a lethal injection, he didn't die right away, he started bleeding and all this crazy bullshit. So now she's like, you know, I don't want to be laying there dying or whatever. And then there was this whole thing of, you know, she's going to be overseen by men, and that can be traumatizing, and blah, 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 blah. So what? You're going to die. I mean, you could choose a firing squad. That's what the OnlyFans chick in the UK is doing. She's choosing a firing squad. I do too. Right. Well, that's what happens, right? I mean, you think about it, 31 years. She's been sitting on death row for 30. This is a problem too. It's 31 years. There shouldn't be, if you're on death row, there shouldn't be 31 years. If you exhausted all your appeal processes and all this stuff, and you can't do anything more, why are taxpayers? Because taxpayers are paying $5,000. Some of these prisoners, like, they figured out that it was like $5,000 a day per prisoner. That's what taxpayers are paying for 31 years. Why? It should be like, okay, you've exhausted all your appeal processes. We can't do anything more. You've went to the highest court in the land. Nothing more can be done. That should be the end of it. Next day, execution. Right. I mean, there's video of it. There's all kinds of stuff. Like, the video is that they left together. The video coming back, she's missing. All of this stuff. She had a piece of her skull. Because if I'm not mistaken, she's also the one that had her and her boyfriend both had the whole in their closets, they had the altars and stuff like that, and she had a piece of her skull on the altar of candles and black magic and pentagrams and stuff like that, and she had a piece of the skull there, which is, that too sounds like she attempted to break. Right. Right. Well, she's done all kinds of crazy shit. That's what I'm saying. 31 years. You got, well, and also you're on death row. When they're on death row, they have nothing to lose. You're on death row. Eventually, at some point, they're going to get around to killing you, right? So you have nothing to lose. You have nothing to lose fighting the other inmates, fighting the correctional officers, fighting, doing whatever you want. You have nothing to lose. You're on death row, right? Puts everybody at risk. Right. That's what kills me about these people that think that, you know, women can't be psychopaths or serial killers, and I mean all that stuff. I mean, look at the movie Monster, you know. I can't remember her name. I'm really bad with names, but that Charlize Theron played, you know, that chick was a serial killer. Everybody wants to give people benefit of the doubt, you know, or women benefit of the doubt. Patty Jenkins. Oh, no, sorry, directed by Patty Jenkins. That was her featured directorial debut. The film follows serial killer Aline, whatever, Warnos, whatever. Right. And that's the unfortunate problem, right? But this was the name of the last name's weird, but that was the chick. She was Rochester, Michigan is where she was born, but she's the serial killer that went around to all the truck stops and killed all those truckers. Jesus. That Charlize Theron played in the movie Monster. That was in 2003. Can't believe that movie's that old already. Yes. Yes. That movie should come out again. Not that they should make a new one, but women today are more like that.
While we're waiting for the jury. I just kind of remind again that we've got people coming in and out at all times. I want to remind everybody of the pending media order regarding certain pieces of evidence. I also want to remind the warning that I gave, I think it was last week, that there are to be no disruptive statements or anything that's going to disrupt these proceedings. If that's done, they will be dealt with summarily, as we say. All right, so just a warning in regards to that. Okay.
What is she crying about now? How do you go to lunch and then come back and like crying?
You all set? All right, yeah. Wait for the jury.
Court, all right, jurors enter. This court's now in session. Please be seated.
Your Honor, for the purpose of the record, we return back to the trial of Commonwealth versus Lindsay Clancy. All parties are present, including the defendant and including the 18 jurors.
All right. Everybody, thank you for your patience. We'll give you a couple extra minutes to look at the solar eclipse while you're up. So what we're going to do is we're going to return now to the Commonwealth's case. Commonwealth, could I call your next witness, please?
Prior to the witness, Your Honor, I would just move to enter in as the next exhibit the excerpted pages from the South Shore Health System Perinatal Behavioral Health Program regarding the last witness, Letitia Dukes.
Okay, any objection?
By agreement, Judge.
All right, so it's by agreement.
226. We would call Nicole Bradley as the next witness.
Thank you.
Just for the record, Your Honor, I object. It's not contested. I don't think it's necessary, so I object.
All right.
Yeah, in Spain.
Same finding.
Does he object to this witness?
But I can do solemnly swear that the testimony and the evidence you shall give to the court and the jury, the matter now pending between the Commonwealth and the defendant shall be true, the whole truth, and nothing but the truth, so help you God. Thank you. You may have a seat.
Watch your step, please.
Good afternoon.
Good afternoon, how are you?
Good, thanks. Just going to ask you to keep your voice up so the jury can hear you and speak into that microphone.
Officer.
Okay.
Thank you. Yes, come on.
Thank you. Could you please tell the jury your first and last name?
Yeah, Nicole Bradley.
And where do you work?
Oh,
Division.
And as one of the roles of the Field Services Division, does the Sheriff's Department engage in what's called hospital watch?
Yes, we do.
Can you tell us very briefly what that is?
Yep. So if any safekeep detainee or inmate goes over to the hospital, we use our deputies and matrons to cover them. on a security watch.
And are the employees from the sheriff's department who are on those watches required to log the activity of who comes and goes from the individuals who they are there to watch?
Yes, they are.
And are those records kept in the normal course of business at the sheriff's department?
Yes, they are.
And you're familiar with those records and what they look like?
Yes, I am.
If I may approach.
Objection to the record.
Okay. All right. You want to approach and then?
Yes, please. Thank you.
Then there'll be no objection.
I don't want it to look like that. Weird.
Yep.
And does that packet reflect the hospital logs that are kept by the sheriff's department?
Yes, they are.
And you're familiar that between January 25th, 2023 and February 3rd of 2023, that the sheriff's department engaged in hospital watch on a patient by the name of Lindsay Clancy?
Yes, I am.
Oh, did you have a gun?
Might be admitted.
Were you in full uniform?
No further questions. Thank you.
Ms. Reddington?
No, thank you.
All right, thank you, ma'am.
Thank you very much.
Just all the people. That's why he objects to all these people.
Calls Dr. Renee Stonebridge.
Yeah, all the local news stations.
Same objection.
Like this over, if it happened in Spain, we couldn't see it here.
All right, same finding, same analysis. Thank you.
Yeah, he's gonna object to all these people. Anyway, we couldn't see it here, but all the news stations played it. It happened 1:30, 1:45.
Good afternoon, ma'am. Stop right there. Raise your right hand to the clerk, please.
Do you solemnly swear that the testimony you may have issued should be true, full, and Thank you. You may have a seat.
Good afternoon. All right, Ms. Sprague?
Thank you, Your Honor. Good afternoon. Can you please state and spell your name for the record?
Yes, my name is Renee Stonebridge, Renee Stonebridge.
Where do you work?
I work at the Commonwealth of Massachusetts at the Boston office.
And what department do you work for?
I work for the Chief Medical Examiner's office.
And how long have you worked there?
I have worked there since July of 2017.
That's why.
And can you describe your educational background?
Yes, I did 4 years of college at SUNY at Stony Brook in New York. I was a double major in German languages and literature and biology. And then I did 4 years at the American University of Antigua, where I got my medical degree. I also graduated with honors, magna cum laude. After that, I did a 4-year combined anatomic and clinical pathology residency program at NYU Winthrop Hospital in Long Island, New York. I also served as chief resident during my final year there, so 2016 to 2017. After that, I did a 1-year forensic pathology fellowship at the Boston office of the chief medical examiner. And then after that, I did a 2-year neuropathology fellowship program through Brown University at Rhode Island Hospital. And I am board certified in forensic pathology, anatomic pathology, clinical pathology, and neuropathology.
What is neuropathology?
Neuropathology is the study of the brain, the dura, the eyes, and spinal cord, and muscle.
What is your role at the Office of the Chief Medical Examiner here in Massachusetts?
My role there is the Director of Cardiac and Neuropathology. I'm also a medical examiner, but my primary focus is brains and hearts.
And so will there be an occasion where a medical examiner is doing an autopsy and they will send you either a brain or eyes or things of that nature to examine?
Yes.
And why are those things sent to you in particular?
We have certain criteria that is followed in order for a neuropathology consult to occur. Some occasions are any children under the age of 2. I am to receive the brain, typically the spinal cord, depends on circumstances, the eyes and the dura as well. Also, if there's any suspicion of some type of homicidal injury to the head, blunt trauma, typically, those cases will typically come to me as well. Sometimes there are cases in which it may just be something that is a surprise. One of the MEs is doing the autopsy, the head is opened up and they see something unexpected. They see something that may be hard to diagnose as someone who is not neuropathology trained, or maybe something like a tumor that is unexpected, or a rare neurologic disease, neurodegenerative disease that requires further neuropathologic evaluation.
And were you tasked with doing some examinations regarding Cora Clancy, Dawson Clancy, and Callan Clancy?
Yes.
And specifically for Cora Clancy, what did you examine?
For Cora Clancy, I examined the eyes.
And what were your findings when you examined her eyes?
The findings when I examined the eyes were that there was acute hemorrhage of the extraocular muscles and adipose tissue. So when the eyes are taken out, this happens after the brain comes out of the skull. And there is a thin portion of bone in the bottom frontal portion of the skull where that bone is broken, and the eyes can then be examined on the inside of the head. Obviously, they're examined also on the outside of the head as well. But you can look at the optic nerve and you can look at the tissue that is surrounding the eyes. So the eyes are within the head with some muscle and some adipose tissue. So there is hemorrhage in these portions of adipose tissue and muscle that is surrounding the eye itself. And then also one of the findings was that the optic nerve sheath on the left side has some punctate hemorrhage. So the eyes, they're sitting in the head, and then there's the optic nerve that connects to the back of the eye and goes to the brain, which sends these signals so people can see. And there was some hemorrhage in this portion surrounding the nerve that connects the left eye.
And are you able to determine by seeing these hemorrhages what caused them?
Hemorrhages themselves are a very general finding. However, given the entirety of the case, knowing what I know from the autopsy findings, I can say it is consistent with something asphyxial.
And why is it that when there's something asphyxial, that means strangulation of some type, correct?
Yes, it can be.
Why is it that these types of hemorrhages occur in the eye?
What happens when there's some sort of asphyxial element to a person, it could be from many different things, but what happens is the blood in the head, if there's, say, some type of compression of the neck or something else that causes asphyxia, there's many things, but if there's some sort of compression, the blood basically gets kind of stuck in the head area. And because the blood can't flow back down through the body, what happens is there's little tiny blood vessels. They're in the eyes, they're in the skin, in the mouth, all over the head region. They basically get blocked up with this blood because it can't move. And these little blood vessels will burst, which leads to these little hemorrhages.
And in terms of Dawson Clancy, what did you examine with Dawson Clancy?
For Dawson Clancy, I examined the eyes as well.
And what were your findings?
The findings were that there was also some acute hemorrhages in these muscle and adipose tissue surrounding the eyes. And then the right eye had some small hemorrhages in the posterior retina and the optic nerve sheath. So the back of the eye, there's the retina within the eye, and the retina connects with the optic nerve at the back portion of the eye. And in this case, there was a little bit of hemorrhage at that connection point where the retina connects to the optic nerve.
And what is hemorrhage?
Hemorrhage itself is just blood that is no longer contained in a blood vessel.
So it's burst from that vessel?
Correct.
And then in terms of Callan Clancy, what did you examine with Callan Clancy?
For Callan Clancy, I examined the brain, the dura, the spinal cord, and the eyes.
And what were your findings?
The findings were that there was hypoxic-ischemic changes. Essentially, that means that there has been some sort of incident which has caused the brain to have a certain period of time in which blood and oxygen flow were not appropriate. So in this case, there was a time frame in which there was no blood going to the brain, there wasn't enough oxygen going to the brain, and the brain will show certain findings in these sort of circumstances. One of the things I note is that there's edema. Edema is when the brain starts to swell. Edema is also a very general finding. It can happen in many instances, but the edema basically means that the brain starts to swell, so you don't have the nice kind of bumpy pattern on the brain. It starts to swell up and it gets a little more flattened because the brain is encased in the skull, so now it's pressing against the skull because it's swelling up and getting bigger. One of the other things I noted with that was that there was compression of the ventricles. So the ventricles are almost like a tunnel system inside the brain that allow for the cerebral spinal fluid to flow through the brain and go into the spinal cord. And when the brain starts to swell up, it not only swells up outwards, but swells inwards on itself as well. So these ventricles that are located in the inside portion of the brain are starting to get kind of squashed because the brain is swelling. Another thing I noted was that the brain was diffusely friable, meaning that it's very soft. So one of the things I do on all my brain cases is they go into formalin. The formalin allows them to fix, which basically firms up the tissue. And it makes the tissue more easy to manipulate. A fresh brain coming out of a skull is very soft. It's very easy to damage it. It's very easy to put your fingers through it if you're not careful. So one of the things that gets done is these brains will go into formalin. I typically will let them fix for about 2 weeks or so. And sometimes, regardless of the fixation time at the formalin, sometimes the brain still will not firm up the way it should, because if I'm receiving a brain and it's already has hypoxic-ischemic changes, the formalin is only going to penetrate the tissue so much because the tissue is essentially already dead.
Can I just stop you for a second? What is hypoxic-ischemic changes?
Hypoxic-ischemic changes is when you are getting lack of blood and oxygen flow. So hypoxic is the oxygen portion and ischemic is the blood portion.
So what you saw with Callan's brain was consistent with a lack of blood and oxygen?
Correct, yes.
Which then led to brain death?
Correct, yes.
How long, based on your training and experience, does it take for a brain to start dying after the loss of blood flow and oxygen?
It varies based on different sources. Most sources say it's between about 6 to 8 minutes. If there is no oxygen flow, then the brain will essentially start dying. It depends on, if there's resuscitation that occurs afterwards, but it's generally in the frame of 6 to 8 minutes or so.
And once brain tissue dies, it can't be brought back, correct?
Correct, yes.
I have nothing further, thank you.
He's not going to ask questions. I got to hold her hand and make her look sympathetic. We're talking about dead children and an autopsy of a dead child.
Hold on, here. Counsel, hold on. We're going to take a short break, all right?
Why?
So why don't we, this is a very short break, come out, we'll come right back, okay?
Court, all right. Jurors, close the notebooks. Please come to chairs, please. This way.
We'll be at a short recess in the courtroom.
Everybody, please go.
Oh, family, come over and hug her. I'm sorry. I know that sounds probably pretty bad, but they knew that this was going to happen. They couldn't have given her. No. I don't buy the tears either. And no, they did a toxicology. And they had 0 medication in all 3 children. Because I said the same thing. And my whole thing was, I didn't know how I felt about that, right? Because on one hand, you think, God, she drugged her kids because, yeah, right? Because you would think that she had the mug with all the chopped up pills in it, right? For herself to commit suicide, right? And you think, she did it for herself. Why wouldn't you have? I mean, even some people, like you read some of these cases where they overdosed them on NyQuil, Benadryl, Robitussin, all this stuff, right? Before doing something horrific. They had nothing. All the toxicology reports come back 0. And so that's one of the things that we were talking about the other day when they came back with the toxicology, that there was nothing. I was like, I don't know how I feel about that. Because on one hand, you think she had all the, she could have done Ambien, she could have done Benadryl, she could have done all the things that she had. That would have been wrong on one hand. But on the other hand, they would have been so out of it, maybe they wouldn't have suffered. Because you still have to think that there's a 3 and a 5-year-old. The 8-year-old, the brain is still going to do the fight or flight, but maybe not as much. I don't know. I don't have children, so I don't know how their fight or flight works at what age. But the 3 and the 5-year-old is still going to have preservation of life. They still would pull, try to save themselves. I don't know about the 8-month-old. I mean, I would still imagine that they're going to be gasping for air. The 5-year-old, definitely, that they're going to be pulling. They're still, I mean, but the 3-year-old, I would think as well. So, because your brain is still preservation, it's still going to save itself. And she gave him nothing. But she gave herself something, supposedly, which I don't believe either, because although they all want us to believe by the picture of the mug on the bedside table, is that she had this mug and it has all the remnants of pills in it. Her levels in her own toxicology weren't above normal for anybody that was taking pills. Yet she wasn't even taking a good amount, or what didn't take the day before, blah, 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 all this stuff. And none of them were even close to overdose amounts. So was she even taking her pills? I mean, it leaves so many questions, because was she taking her pills? If she did take the pills that were led to believe that she took in this mug, did she not take them for a couple days and then took these, and that's why they were at the levels they were? Or did she just make it look like she took some, throw it out? Because I can bust up a bunch of pills, make it look like that, put it in a glass, and dump it down the drain. Doesn't mean I took them. Just gives you the appearance, the assumption that I took them, right? But if I'm taking pills and my levels aren't above that, I can tell you I took them. Doesn't mean, I don't think she thought all of the things. Maybe she doesn't watch true crime enough to know of all the things that they would be checking for. They were all face down. I think 3 pins, I would think. So that's what I was thinking too, right? They were all face down, right? So I think what she did was put it, and this again, just a theory. So it's kind of like the cop theory, like talking to the other cop, just working it out through your head, right? Those kids trust her enough that she could have sat him down between her legs, wrapped it around him, and then pulled it tight, right? And then got up and walked away, went upstairs, did her whole walking around, looking at herself in the mirror, standing there slicing her wrists, which were insignificant, right? And then, superficial, that's what they kept saying, that her lawyer's like so pissed off about, because they were superficial. She needed 1 stitch on one side and 3 on the other just so it wouldn't keep tearing, right? So, which are, if you're slicing across her whole wrist, and nothing on her neck. So superficial, but you're standing there and you're looking and it's just dripping, right? Because you got it good enough right here that it can drip. And then she has to move the bed away from the window, which, why would you choose that window? But okay, you chose that window. Move it away. You lean out over it. You see the window. I think what she did was she seen the window well and was like, can't jump out there, because most people think, people jump off cliffs, all this stuff. They can survive jumping out a window. It's not that difficult. You can jump out a 2nd-story window. You may break your bone, you may break your collarbone, you may break a rib, maybe a femur, whatever. May make that work. She went downstairs to check on the kids, make sure that they died. And maybe they're all laying there. People cover things up. A lot of people, when it's like somebody and you can't like look at what you've done, cover them up, cover them with blanket, cover them with a pillow, whatever. I think she turned them over. Yeah, like it was staged, right? So she couldn't look at their faces. She couldn't. So I think she turned them over because they were all on their face. The only thing is the one police officer said that Patrick yelled down and said, "Get down here! There's fucking kids hanging in the there's a fucking kid hanging in the basement." Which then again, she was the only one who said it. Everybody else said they heard screaming to get downstairs because the kids were dead. She's the only one that said that portion of it, which that's hella crazy. So was there one in the office that was hanging in the basement? Which is another thing too, is you have to realize that out of all the places in the whole house she could have killed the kids, she chose in the basement, and one specifically in his office, which is a whole nother thing. Like, did you choose to do that because, well, if he kept the house or if he stayed there or whatever, he would always remember his dead kids in the basement? I mean, that's a whole another psychological trip and manipulation tactic, that you always remember that your kids died here. Because that's no different than the chick that I just showed yesterday, right? Say goodbye to your kids, right? She did basically the same thing by putting a child, the youngest one, right, in his office. I mean, that's horrific shit. Right, to hurt him more, right? So if you're looking at all the like the things, and then she goes around, she goes to all these doctors, and I know her defense is using like the doctors didn't do enough. Well, the doctors can only do so much. You can't force people to come into therapy. You can't force people to stay for therapy. You can't force people to sign up for therapy. You also can't force people to take medication. You can suggest, and as if you look at all these, especially with today, like everybody's like, well, what do you want? What do you want? What do you want? Well, she went to like how many damn doctors? And then she was like, what was her need to be addicted to Ativan? I feel like I'm addicted. I feel like I'm going to get addicted. I feel like I am addicted. But yet nothing ever showed that she was addicted to Ativan. But what was her need to be addicted? And if she truly felt like she was addicted to Ativan, why didn't she just quit taking the Ativan? And when the doctors tried to wean her off the Ativan, why did she keep saying, well, I need to take it? Like, okay, like, if you had such a fear of it, why didn't you just quit taking it? And why did you see so many damn doctors? And why did you stick to a plan? Why didn't you listen to all the doctors? Like, listen, I mean, it's like going to a dog trainer, right? You know, like trying to train a puppy, working with a dog trainer. And then you're like, yeah, I don't like really how this is going. So I'm going to go to a different trainer. And then, well, that doesn't work. And I'm going to go to a different trainer, but doing it like every other week, right? Like, so this week I'm going to this trainer and I don't really like how that's going. Like the dog just isn't sitting fast enough. So I'm going to go to a different trainer. And well, that trainer's not getting the dog to like lay down fast enough. So I'm going to go to a different trainer. Not only is the dog going to be confused as fuck, I don't know what the hell was going on. And all these trainers are probably going, oh, what the fuck, right? But I mean, this is basically what we're hearing is they're all talking to each other, probably going, I don't know. I don't know what the fuck is going on. And we're all trying to do our best, but you can't force somebody, one, to take medication and take it properly. You can prescribe it, which is why you see 1 pill, 3 pills, 14 pills, blah, blah, blah. Because I'm not giving you a full 30 days. Well, I'll give you 30 days for this, but I'll give you whatever, 14 pills one day, one whatever, right? Right. At some point, at a certain point, it's the dog owner's fault, right? And at a certain point, it's her fault. She's seen 5 doctors, 2 hospitals, called these places. And then this is the thing too, right? As you look at it, they say, oh, well, she called the one hospital and they said, well, you don't meet the criteria. Okay. Well, now it's the hospital's fault that she didn't meet the criteria to get a bed placement. No, because, well, there may be somebody out there that literally, they probably seen through her real bullshit that they just don't want to tell people. But they probably seen through her bullshit and her manipulation and probably lies or whatever the hell that she was playing and following this checklist of shit. And there's probably real people out there that really need help, that really do have a plan, that really are probably going to hurt themselves, that are probably going to do step by step, that really need a bed in that hospital. And so for her, suicidal thoughts or intrusive thoughts of hopelessness is not suicidal thoughts, it's hopelessness. Millions of people feel hopelessness every day or once in a while, or just like overwhelmed or have fogginess or whatever. And like, you know, some people are like, you know, look at the world today and go, shit, glad I'm not going to be around in 20 years when all these kids grow up and they're taking, you know, they're running the country because this country is going to hell in a handbasket. So like, you know, would that be considered a suicidal thought? I mean, like, you have to think about how, like, she was overwhelmed. She had 3 kids. She had postpartum depression on her second kid. Nobody made her have her third kid. Did she not think it was going to be harder for her third kid with 2 young kids, a 4-year-old and what was it, a 3-year-old, 4-year-old and a 2-year-old, something like that. So it would have been even harder for her to adjust if it was hard just having the 2, you know, like she should have had a plan. She was a labor and delivery nurse. She should have known, like, hey, I didn't, like, at some point you have agency, first of all, over your own body. Everybody does. And second of all, you have to take accountability for your actions. And third, why are we not even asking the question, why did the children have to die? Her whole thing is, her voice told her, if you don't do it now, there'll never be another chance. Or if you don't do it now, what was it? If you don't do it now, something. I forget what it was. But if you don't do it now, then what? Then what? Why did the kids have to die? Exactly. Exactly. And why never again? Does she hear him now? She never heard him before. Just that one time, and she said, this is your only chance. If you don't do it now, if you don't do it now, what? And the thing is, she called Patrick while he was out. Why didn't she call Patrick when she heard the voice? Be like, look, you need to get home like ASAP. Forget the food, forget whatever. You got to get home. Like, she took herself to the hospital before. She called the hotline before, twice before apparently. So why didn't she call the hotline? What made her? You see what I'm saying? Like, this doesn't make sense. She heard a voice. If you don't do it now, why did, like, I just don't believe in this whole bullshit of the kids had to die. If you don't do it now, what? You'll never have your life? You're not going to have your life anyway. I mean, obviously you're not going to have your life. Exactly. And it's weird that it was, hey, I'm going to text you. Ugh, why you're in the house. This is weird to me too. You're in the same house. She's upstairs, you're downstairs. Not you, listen, you, but the proverbial you, right? So you text, what do you want for dinner tonight? You want to go out to eat? Because I don't feel like cooking anything, or I didn't make anything, whatever. Why didn't you just go down and talk to him? You text him, then you text him the menu, you order everything, you get everything set up, you do all this stuff. Like, do people just not talk to people anymore? My husband's in the house, I'm not texting him. Like, he was in the west wing of the house. He was in the basement. It's just so weird to me. Right. And why not go back? Right? So you go to the hospital for 5 days. You plan to check yourself in. You want to do all this stuff. And I get you want to be home with your kid for her birthday, all that stuff. But why didn't you just plan to go back then, the day after? It's a weird concept to me. That it's almost like this whole delusion of, I wanted help. See, I wanted help. See, I was trying. I was turned away. I was this. I was that. It's like this make believe, because nothing she did truly wanted help. You can't try a pill for one day. It's horrible. Unless you were having an allergic reaction, then I totally get it. But like, nothing. It was like, no, she blamed all her things on every pill that she tried. What was this? It was this. It was it. So then just go cold turkey off all the pills, and then go to, a psychiatric treatment facility, take a break, figure out what's wrong, stay in there, and then go from there. That would truly show that you wanted help. If it was really as bad as what they're portraying it to be. Right. I agree. I mean, that's what I think. I think it's crazy that it was for 5 days and her excuse was, well, I want to be home for my daughter's birthday. I don't know. My question is, though, why her need to be addicted to Ativan? That's weird. I don't know. I just have a lot of questions. And I don't feel like me personally, I don't feel like the defense is doing a whole lot of good. Like, because all he does is rehash everything the prosecution is doing. Just asking the same questions, but they're just going, oh, so you didn't talk to the other doctors? Or if you did talk to the other doctors, like, he doesn't really ask like really legitimate questions. Like, I don't think he's helping her case at all. And he was always asking somebody else about somebody else's questions or somebody else's notes. Right. You would think, right? Well, and that's the thing, the whole taper down thing, right? So she wanted to taper down on this and then didn't want to taper down. That's what I'm saying. Her actions never matched the words from the notes, right? I couldn't imagine being like a therapist or doctor in there and then know that like your words were going to be so scrutinized in court, like knowing that you're there trying to help somebody talk to somebody or whatever, and then you're going to, because every one of those psychiatrists they brought in there so far, they're in this lawsuit for malpractice, not taking care of her properly. So I'm sure that's why they're being so methodical in the way that they're trying to say things. That's why he keeps trying to bring that damn civil trial into a criminal trial. Because if they don't find her guilty, or if they don't find her guilty in this trial, that only boosts their civil trial because it's such a lower bar in a civil trial. Right? Well, and that's the thing. And I think that's why now, if you've noticed especially since 2020, all doctors now, I mean, even like I have 8 doctors at Cleveland Clinic. I have like a whole team because of the cancer and everything. So I have like all my doctors are like, well, what do you think?
Can I see it sidebar?
Oh, Jesus. We come back and we're going to go to sidebar. But I have a whole team that are like, okay, so they all talk to them, but we do it by Zoom, right? So they're all in there and we're all talking and I can see all their faces and all this stuff. And so I don't have to go up to Cleveland Clinic all the time because it's like a 2-hour drive for me. So I just have to go get my blood work done and I have to go get CAT scans and PET scans and stuff like that just to make sure the cancer hasn't come back and all this stuff and blah, blah, blah. So I can do all that down here and then they do all the, read all the results and all that stuff up there. And they'll be like, okay, so we'll do this, 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 and this. Okay, what do you think of that? You're on board with that? You good with that? Blah, blah, blah. Is there anything that you want to do? Is there anything that you need to do? Anything? I mean, they're always, and they make you feel like you're part of the team, but they don't want to do anything that you don't want to do. And I think it is because everybody's so afraid of it.
All right, George entering.
So it's all what you want to do. But I think that's all since 2020. And those are medical doctors. I'm not psychiatry doctors. I mean, I have to go up there once a year and like see them all in person, but I have to be checked every 6 months. But I don't have to talk to. I don't have.
This court's now in session. Please be seated.
Your Honor, for the purpose of the record, we return back to the trial of Commonwealth versus Lindsay Clancy. All parties are present, including the defendant and including the 18 jurors.
All right. Well, members of the jury, I just kind of want to revisit an instruction I've given you a couple times, I think, during the course of this trial. It's important to understand and remember that sometimes there's evidence that's presented in the trial that creates an emotional reaction. But as jurors who have taken an oath to follow the law, I'm instructing you that the law says you must separate any emotional reaction on your part from the informational value and weight that the evidence produces. Your verdict in this case is going to have to be based solely on the evidence, and it cannot be based on sympathy or anger or passion or prejudice. All right, so you've got to keep that in mind. And so with this, we're going to go to the next witness.
I'm Lindsay Clancy.
Nicole. Vidal, Olsen.
Same objection.
Same finding and analysis.
He doesn't want any of these medical examiners in there.
All right, good afternoon, doctor.
Good afternoon.
All right, I'm going to ask you also to keep your voice up so the jury can hear you and speak into that microphone if you would.
Okay.
All right. Ms. Sprague.
Thank you, Your Honor. Good afternoon. Can you please state and spell your name for the record?
My name is Dr. Barbara Olsen, BARBARAOLSON. I previously practiced under my maiden name, Barbara Vidal, VIDAL.
Can you describe for us your educational background, please?
I completed my undergraduate studies at the University of New Mexico. I also completed 4 years of medical school at the University of New Mexico School of Medicine. Afterwards, I came to Boston to study the field of pathology at Beth Israel Deaconess Medical Center. I completed a 4-year residency program there, studying both anatomical pathology and clinical pathology. And after my residency, I did a surgical pathology fellowship studying the gastrointestinal tract, liver, and pancreas. And I ended my training doing a fellowship of forensic pathology at the Boston office of the Chief Medical Examiner. I am board certified in anatomical pathology, clinical pathology, and forensic pathology.
And what is forensic pathology?
It is essentially the study of causes that are diseases, disorders, or trauma that results in sudden, unexpected, or non-natural deaths.
And do you currently work at the Office of the Chief Medical Examiner?
Yes, I'm a medical examiner at the Cape Cod office of the Office of the Chief Medical Examiner.
How long have you worked there?
Since 2021.
And approximately how many autopsies have you performed?
I have examined over 1,900 bodies and performed over 800 autopsies.
Oh, wow.
And when performing an autopsy, is there a specific process or procedure that you follow?
Yes, so an autopsy is composed of many parts. The first part being documentation review, and the second part being the examination of the body, which is broken up into two parts. The first part being the external examination, where I look for identifying characteristics of a decedent, such as eye color or hair color. I also look for any evidence of natural disease or trauma on the outside of the body. And the second part is the internal examination, where I create a Y-like incision on the chest and abdomen and examine the soft tissues, bones, and organs, looking for any evidence of natural disease and trauma. I also examine the brain.
And did you perform an autopsy on Cora Clancy on January 25th, 2023?
Yes.
And did you follow that same process with Cora Clancy?
Yes.
And so that started with a document review, is that correct?
Yes.
And what type of documents are you reviewing when you do that?
Typically, I have a preliminary police report to review, as well as either EMS records or records from the emergency department.
And did you start with an external examination of Cora?
Yes.
And what did you observe during that external examination?
The external examination of Cora, I saw evidence of medical intervention. She was intubated, had various EKG pads and defibrillator pads on her body. She also had a catheter on her right hand and puncture sites on her left hand and her left groin. She had her neck stabilized with a cervical collar, and she had an intraosseous catheter, which is a type of IV they put directly into the bone on her right lower leg. Her hands at the time of my external examination were covered by police evidence bags, and they were secured at the wrist with tape. When I removed those, the fingers showed no evidence of injury, and the fingernails were all of equal length and intact. And then I noted evidence of trauma of the neck with associated injuries of her head and minor injuries of her right arm and of her legs as well.
And in terms of the injuries that you observed, evidence of trauma to her neck, were there also injuries to her face and neck area that seemed to go along with the trauma to her neck?
Yes, there were findings of the head that were associated with the trauma of the neck.
And what were those?
So on her neck, she had a ligature furrow. A ligature is an object used to apply external force to the neck or compress the neck. And a furrow is simply the pattern of injury that develops underneath the site of compression. So for Cora, her ligature furrow consisted of a linear, horizontally oriented area of pallor or paleness around her neck with distinct superior and inferior edges. On the front part of her neck, the lower half of the ligature furrow was associated with additional red abrasions ranging from 1 to 2 millimeters in size. And on the back of her neck, the superior and inferior edges of the ligature furrow had developed some linear bruising as well.
And what do you mean by a furrow?
So again, the furrow is a ligature is when you have external compression by an object on the neck, and a furrow is simply a pattern of injury that occurs beneath it. It can be an imprint, it could be a pattern, or it could be more developed types of injuries such as bruising or abrasions.
And what about injuries?
All right, Counsel, could.
Yep. They need to
We're gonna take a break this time, all right?
All right. Jurors, close your notebooks. Place them on the chairs, please. This way, please.
That's disruption of court. They need to remove her from the courtroom.
recess for a few minutes. I'm going to come back. We'll speak to council in regards to schedule.
Scheduling. They're going to call it for the day. See how this is going to work? They still have a whole other autopsy to get through. They're going to have to put her out of the room. Because this is playing on the jury. The jury didn't hear any of that. Yep. And that lawyer should have stopped her. I mean, did you hear how loud she was? You could hear her over how loud they were trying to be. And you could hear her plain as day. I can't do this. I can't do this anymore. You could hear her plain as day. So imagine how loud it was in the courtroom. Right. Because they don't want all this. He keeps objecting to these medical examiners doing this because it shows the jury. I mean, yes, I understand it's children's autopsies, but this is part of evidence. So he keeps objecting to it. So the judge is allowing it because, well, it's part of evidence. This is the crime that was committed. And so how else do you get it to be thrown out? This is how you do it. Because they're not going to pay attention. They're not paying attention to a shit thing that she's saying on the stand. Or that the prosecutor's even asking. They're watching her. That'd be no different than if a guy was sitting there yelling and screaming or saying crude things. They would put him in a different room. Give him a TV, give him a headset, and mute him if you wanted it. Just like they did with Brooks. This is crazy. I can't even believe that they're allowing this. And the lawyer knows that. That defense lawyer knows that. They didn't even get through this autopsy. They still have another autopsy to go, which Cora is the oldest. Yeah, it's a strategy. Yep. Yep, exactly. I mean, it's the same thing. Like, did you watch the Brooks trial? The guy who ran into the parade with his SUV? He did the same thing. He sat there and he yelled over testimony. He yelled over everything. He built a box fort. He did all kinds of stupid shit. They kept putting him in another room. Oh, yeah, that's a crazy thing. He was pro se, though. He didn't have a lawyer. He thought he was smart enough to do it himself. Another trial I want to cover is the Mangione trial. That's supposed to start, I think he has a preliminary hearing in September, and then I think it's supposed to start in October. That's the guy in New York who walked up to the medical CEO and shot him in the back of the head. That one's crazy too. There's women that are that pay his commissary, that want to marry him, think he's gorgeous, love him, all kinds of. Yeah, that one will be interesting. Yeah, he has two trials because they're trying him federally and state. So that one will be nuts. But they're trying him state first, and then they'll try him federally. I wanted to do the Courtney Clenney one, but she took a plea deal right before her trial was supposed to start in September too. She's the OF chick that stabbed her husband or stabbed her boyfriend with a paring knife. She took a. Right. I think so too, right? Nuts. But anyway, the Courtney Clenney, she took a plea deal yesterday. It was either yesterday or Monday. That crazy girl is going to kill somebody again. I will lay money on that. She was dating a pretty big, like, muscular black guy. Oh, you gotta look her up. Courtney Clenney. She was an OF girl. Pretty well up, made millions on OF, OnlyFans. There was video of her everywhere. She was not video of her everywhere doing OF, but she was arrested 3 days prior to her killing him. She's a white girl. And she was arrested 3 days prior for domestic violence. Their place was like, had cameras everywhere, even their elevator. She beat the living crap out of him in the elevator, and he just stood there. And like, just basically was holding her off. And she's just like beating the crap out of him. Anyway, she 3 days later killed him. And while he's dying, she decides to go live. Her interrogation. Search on, it's wild. Search on YouTube, Courtney Clenney. It's Courtney, Clenny. And her interrogation, she's more worried about the blood she has all over her than the fact that her boyfriend died from a paring knife, like stabbing him right in the heart with a paring knife. And like blood everywhere. When she went live, blood looked like a crime scene, because like when you stab somebody, like, and then pull it out, like it just squirted everywhere. But she was so covered in blood, like in her interrogation, the blood was everywhere. It was so, like, you literally looked like she was walking in a slaughterhouse. And then her parents got arrested because they smuggled her from Florida to Hawaii. It's a wild case. She took a plea deal either Monday or Tuesday. Might have been yesterday. I don't know. It's either Monday or Tuesday. She only got 6 years. Well, she's already been in prison for 4, because this happened in 2022. So she gets out in 2 years. And the shit that she was doing while she was waiting to take the plea makes her look like she was still an OF girl. Like, she's sitting there going, waiting to take the plea. I was like, oh my God. It was wild. And the judge didn't have to accept it. The judge never has to accept a plea, and the judge still accepted it. So she got 6 years, 5 years probation. And I'm just like, that she should have got the death penalty. She killed him for no reason. We are so soft on crime. It's amazing. And she, of course, claimed self-defense. But if you watch the videos, she beat the crap out of that man. And of course, he's a big black man, like lots of muscles and stuff like that. And no man wants to be like, you know, my girlfriend beats the crap out of me. You know, I think the least amount of domestic violence that's ever reported is men. What's going on? Right? I say that all the time. I talk to my one friend, and we say that all the time. Like, what happened? What are they putting in the food, the water, the air? Yeah. And the thing is like his family is like really from Africa, so they were here. They couldn't speak English, so somebody read her victim impact statement was so sad. And the whole time she's just sitting there going to their side. It looked like it was to their side. It was either that or to the cameras. Not really sure what she was doing. It was wild, just wild, why they were doing their victim impact statements. I was just like, I don't know. I don't know what is going on with the world that we are, that, you know, killing people over cheeseburgers and orders not being correct, and OnlyFan models are getting 6 years when they should get life in prison. Yeah, absolutely. And the thing is she looks nothing like she did 4 years ago. Nothing. But I think in her own head, she thinks she does. Because, you know, prison changes you. But in her own head, she thinks she still looks like that.
Session, please be seated.
For the purpose of the record, we return back to the matter of Commonwealth versus Lindsay Clancy. All parties are present, excluding the jury.
But I mean, look at the Johnny Depp and Amber Heard thing, you know. Amber Heard thought if she could get away with making Johnny Depp look horrible. And you have to feel bad for like how sad that whole case was. It was just, Johnny Depp was just a victim who wouldn't tell anybody. Yeah. And there's still men out there that'll be like, I can fix her. That's the sad part. There'll still be men out there that say, I can fix her. I don't know. And I'm not saying that all women are bad. I'm not saying that all men are angels. I'm just saying that lately it seems like something's in the water. And we're just like, so many women are out there like, oh, hate all men. And I'm like, for what? It's not- Right. Well, I think that's because women are trying to be too much like men, and then for whatever reason, women want men to be like women, you know, have emotions and be soft and all this shit that I'm like, no, it's not a man. I want my men to be like men. And women are supposed to be like women. I don't understand this whole weird dynamic that everybody are. Oh, they're actually going to let her play out, right?
Yes, I am still on.
He's probably telling her, now you're not allowed to cry or call out or anything like that. But if you have to, go ahead.
All right, jury. Court's now in session, please be seated.
Your Honor, for the purpose of the record, we return back to the trial. All parties are present, including the defendant and the 18 jurors.
All right, Attorney Sprague?
Thank you, Your Honor. You had described previously the injuries to Cora's neck. Were there also injuries on her face that correlated to those marks?
Yes, on examination of her face, she showed diffuse petechial hemorrhages of the skin of the face, most prominently around the skin of the eyes. She showed petechial hemorrhages on the inside of her eyelids as well as the inside of her lips.
And if I could have photo 2246, please. Doctor, there's a remote here. If you press and hold the top button, you can highlight what you're talking about in the photo when it comes up.
Oh, they're going to show it in court.
What are we seeing here? Is that the area of the petechial hemorrhage?
Yes, in this photo, I have the lower lip pulled down, and on the inside of the lower lip, we can see punctate hemorrhages, which are the petechial hemorrhages.
Okay. And if you could, is that working for you? I can need to see that. This area here?
Yes.
Okay. You just hold that top button and hold it down. And so we can remove that photo. When you talked about petechial hemorrhage in the eyes and eyelids, did it look similar to that?
Yes.
Oh,
And basically it's those red marks all around the mouth, and then those same red marks were on the eyes
Yes.
eyelids? You tell me where they were.
So they are pinpoint hemorrhages that occur. And again, they were located on the inside of the eyelids. So I inverted the eyelids and I lipped open the inside of the lips, and they were also in those locations.
And she's crying again.
And if we could have photo of 7784, please. You could tell us what injuries we're seeing here in this photo.
In this photo, we are looking at the body from the left, and you can see the ligature furrow in this photo. Here is the linear area of pallor with the distinct superior and inferior edge. You can also appreciate in this photo some small punctate hemorrhages or the petechial hemorrhages of the face.
And if you could show photo 7782, please. What are we seeing here in terms of injuries?
In this photo, we are looking at the front of the neck, again, focused on the ligature furrow, which is this distinct area, linear area of pallor. And on the front of her neck, the lower half of this ligature furrow had scattered red abrasions associated with it.
Take down the photo. What are abrasions in terms of what you do?
So abrasion occurs when there is sufficient friction against the skin to cause a removal of the superficial layer of the skin.
Is it basically a scrape?
Yes.
And can we have photo 2256, please? You can tell us what we're looking at here, please.
This is a close-up photo of the back of the neck. Here is the linear area of pallor with the distinct superior and inferior linear edges. You can appreciate that the linear edges in this photo started to develop linear bruising.
And were there other injuries on the body other than those on the neck and the face?
Yes, she had injuries to her right arm and on her legs.
And if I could show you photograph 7789. Are you able to tell us what we're looking at here?
This is an up-close photo where we can see a very small, faint bruise. All of the bruises on her legs as well as her right arm consisted of small scattered bruises.
And if we could have photo 7770. What are we seeing here?
This is an image focused on her right leg. Here we see 3 bruises on her knee and 2 bruises on her left lower leg. This is a site of medical intervention, the intraosseous catheter site where the needle enters the bone.
And if we could see 7790, please. What are we seeing here?
This is a photo, a close-up photo of her left leg. Again, we can see a bruise here as well as a bruise here on her left lower leg.
And then the last photo, 2233. Oh, I'm sorry, one more after that. What are we seeing here in this photograph?
In this photo, we can see the bruises I described earlier, as well as the inside of her left ankle. We're seeing 2 additional bruises.
And if we could see photograph 7794. What is shown in this photo?
This is an image of her left leg, again showing the 2 bruises close to her left ankle and then additional bruises on her left lower leg.
And then 7775, please. What are we seeing in this photo?
This is an image of her right arm extended, and I have the image focused on her right bicep where there was 3 small bruises.
Did she hold it?
In terms of bruising, are you able to tell the age of a bruise by looking at it?
No.
Can you tell whether it's a fresh or an old bruise?
So generally speaking, we can appreciate the color of bruises. So red, blue, purple bruises tend to be bruises that occur more recently. And as they heal over time, they start to take on a yellow or green appearance.
And the bruises that you observed on Cora's body, how did they appear?
They all had versions of red appearance to their shapes.
So because they had red appearance, does that mean that they are fresh wounds?
They occurred recently.
And again, you can't tell how they occurred or what the exact time and date they occurred.
Correct.
Is there any information you can glean from the location of the wounds where some of the bruises were close together, like the 3 on the knee or the 2 on the lower right leg?
No, I can only document where they are and their measurements.
Now, If I may have a moment.
Sure.
Going back to the injuries on her neck, what do those tell you based on your training and experience, when you're trying to determine the cause of death? What do those wounds tell you?
When I see a ligature furrow that is horizontally oriented in association with significant petechial hemorrhages, those findings are consistent with a ligature strangulation.
And what is ligature strangulation?
Again, a ligature is an object used to apply external force to the neck, and a strangulation is when it is done by someone else.
And when that happens, what effect does it have on the body? How does it? What is the mechanism of death?
Ligature strangulation results in a category of asphyxial type of deaths. Asphyxia means that the body is deprived of oxygen, and in this case, specifically the brain. So when you have compression on the outside of the neck, blood is how oxygen is delivered throughout our body. So the right side of the heart delivers blood to our lungs, where during breathing and respiration, we then put oxygen into our blood. It then moves to the right side of our heart and gets pushed out to our body through blood vessels we call arteries. Once the oxygen is released at its targeted site, it then recirculates to the right side of the heart through blood vessels called veins, and the process starts all over again. It's a continuous circulation. But when you have compression of the neck, first and foremost, your airways reduce, it's compressed. So you can have a reduction in your ability to breathe or complete inhibition in your ability to breathe. When you have compressions of the veins of the neck, the blood cannot drain from the head. And so then the blood actually has a backwards flow of pressure that meets the arterial blood. And that results in an increase of blood pressure within the blood vessels, as well as an overall increase in intracranial pressure. And with the compression of the artery, there's no oxygenated blood being delivered to the brain.
And as this blood is gathering in the face and head area, is that kind of causing the same type of pressure as a balloon filling up?
Yes, or like a water pipe as well.
And what happens as that blood pools and causes that pressure in the face and the head?
What normally happens is, first and foremost, the brain just has a reduced ability to take in oxygen. And in the smallest vessels in the face and brain, such as capillaries or venules, they are subject to rupture.
And as that pressure is building in those veins and are rupturing, is that painful?
Just like our blood vessels run throughout all of our body, there are nerves throughout all of our body as well. And so there is a component of pain present until loss of consciousness occurs.
Oh.
And how long can it take, or does it take, for loss of consciousness to happen?
I cannot put a specific time on it for the interval. There's multiple variables to consider in a case-by-case basis. The type of ligature used, the force of the ligature used against the neck, as well as the intensity and duration of the altercation. However, in situations where there's complete oxygen deprivation, loss of consciousness can occur as early as 10 to 30 seconds, with brain damage beginning at the 1 minute mark and irreversible brain damage and subsequent death occurring around as early as 5 minutes, again, with the caveat that there are variables that might accelerate or decelerate that time frame.
Is there a type of constant pressure that's required to cause that loss of consciousness?
Ultimately, once the brain has a critically low level of oxygen, a loss of consciousness will occur. It takes an average of 4 pounds to compress the veins of the neck and an average of around 10 pounds to compress the arteries of the neck.
And so if someone's squeezing something or pulling something around the neck at that 4 pounds or 10 pounds of pressure in a consistent basis without any resistance, does unconsciousness happen faster?
It could occur faster, yes.
What if someone's resisting or struggling or pulling away? Could that take longer?
When the body is in a state of stress, you have a stress response that demands an actual increase in oxygen utilization by our body. So in the presence of an increased demand with a decreased amount being delivered to the brain, it can accelerate the timeline to loss of consciousness.
What do you mean by accelerate the time to loss of consciousness?
No.
You can ask.
It would just make it occur faster.
And so if that pressure isn't constant, say someone struggles and is able to get free a little bit, and then you have to tighten it again.
You
Does
don't
that make it take longer?
Sustain.
You said anywhere from 5 to 30 seconds. What are the factors? I'm sorry, you said 10 to 30 seconds. Is that correct?
Yes, for loss of consciousness.
What are the factors that are at play for whether it's 10 seconds or 30 seconds?
Again, there's multiple variables. So the force of the ligature against the neck, the actual ligature itself, and the intensity and duration of the altercation.
And once someone loses consciousness, do they immediately die?
No, so if there's no intervention, the brain continues to have a lack of oxygen. And so until the brain cells start to die, it's irreversible injury to the brain. The person is alive until the body can no longer sustain the lack of oxygen.
If someone is strangled to the point of unconsciousness and the strangulation stops, can they wake up?
Without intervention is very unlikely.
So do you recall testifying previously that when asked if a person were to use a ligature around someone's neck to the point where they pass out?
But counsel, we had that answer, right?
It's an inconsistent statement.
This is your witness.
I know, and I can impeach with an inconsistent statement.
I see it sidebar.
No. Oh. That's tough. Impeach your own witness. But if she's saying something that she didn't normally or didn't say before, she must have been voir dired and said no, or yes, that they could wake up. Because you can. People strangle people all the time to unconsciousness, and then they wake up, and then they strangle them again. The roadside strangler did that to a lot of people, to a lot of women. He would strangle them, let him wake up, strangle him again, let him wake up, strangle him again, and it's a roadside strangler.
No. Once the brain is subject to oxygen deprivation and brain cells start to die, it's irreversible, and so it will continue to progress towards death if there's no intervention.
What do you mean by intervention?
Resuscitative efforts, if somebody tried to give CPR.
Oh.
It would be your opinion that pressure would need to be continually applied even after losing consciousness to cause death?
Sustained.
Hold
on. Sustained. Next question.
So your testimony is that you can strangle someone for 30 seconds, let go, and then they die.
I said that in this presence of complete oxygen deprivation, there is a general time frame. And so 30 seconds, I cannot give a specific number to that. Once strangulation occurs, again, the brain starts to be subjected to a lack of oxygen. So whether the ligature is present or whether the ligature is not present, the oxygen deprivation and irreversible brain damage is already occurring.
And there's no coming back from that?
Not without intervention. It's very unlikely. Again, the brain cannot heal those cells.
Did you form an opinion to a reasonable degree of professional certainty, to medical certainty, as the cause of death of Cora?
Yes.
And what was that?
Asphyxia.
And was that by manual strangulation?
By strangulation.
Mechanical strangulation, I mean. Yes. Did you also examine or do an autopsy on Dawson Clancy?
Yes.
And when was that?
January 25th.
And did you observe injuries on Dawson Clancy when you did the external examination?
I did observe injuries to Dawson. He had trauma to his neck with associated injuries of the head, as well as minor injuries to his left arm and his legs.
And if we could pull up photo 2166.
He's getting so irritated.
What are we seeing in this photo?
This photo is a picture of the lower lip of Dawson being pulled down, and we can see, again, similar to Cora, these petechial hemorrhages on the inside of the mouth.
And can you also see them on the eyes in this photo?
You can see periorbital petechial hemorrhages, so the skin around the eye.
And were there also those same type of hemorrhages when you lifted the eyelid?
Yes.
And if we could have photo 2149. What are we seeing here?
Dawson on his neck, similar to Cora, had a linear, horizontally oriented ligature furrow consisting of an area of pallor around the neck. He had distinct superior and inferior edges to his furrow as well. This is on the back side of the neck, where we can also appreciate abrasions that are in line or parallel with the inferior and superior edges of the furrow.
And if we could have photo 2147, please. What are we seeing in this photograph?
In this photograph, we can appreciate the distinct area of pallor here on the neck, again representing the ligature furrow with diffuse petechial hemorrhages of the skin of the face.
And what are we seeing there on his shoulder?
This is just some dried body fluid.
And if we could see photo 2151, please. What is depicted in this photograph?
This is a similar photograph to the one just shown here, where you can see the distinct area of pallor representing the ligature furrow with superior and inferior edges, and again, the diffuse petechial hemorrhages of the face.
And these photos of Dawson's face, the petechial hemorrhaging on the face, appear to be darker than those and more expansive than those on Cora's face, correct?
They appear more prominent in Dawson than in Cora, yes.
And what can cause the damage being more prominent and more dispersed over the face?
Again, petechial hemorrhages occur as a result of rupturing of small vessels in the skin. And so the fact that there are more present in Dawson is indicative that there were moments where some blood did reach or push through the furrow or the ligature in little spikes or peaks, which would just result in momentary increases in blood pressure that would result in more petechial hemorrhages.
And what would cause that blood being able to flow?
Any movement against the carotid arteries. The carotid arteries are thicker and more muscular than the veins, so they're more likely to push through with the blood. So that could be movement of the ligature or movement of the person handling the ligature or movement of Dawson himself.
So it could be from Dawson struggling, or it could be from more pressure or force of the ligature?
Yes, changes in the pressure of the ligature.
And if I could see photo 2143, please.
Who keeps up crying this
What are we
long?
seeing in this photo?
This is the back of his left forearm. It is a little pale with the light, but there were 3 small bruises on the back of his left forearm.
And going to photo 2155. What are we seeing in this photo?
This is a picture of us. So at this point position, Dawson is face down. So we're looking at the side of his right leg, and we can see a small faint bruise here.
And then going to photo 2144. What are we seeing in this photograph?
This is an up-close photograph, but I can appreciate that there are small bruises in the center of the image.
And photograph 2156. What are we seeing in this photograph?
In this photograph, we're looking at the back of the legs. The one closest to us is the left leg. The one farthest from us is the right. You can see bruises here, here, and here, as well as the inside of the right knee.
And so when you said here, here, and here, that was the outer portion of the
left upper leg.
Thank you. We could have photo 2119, please. What is depicted in this photograph?
This is an up-close photo of his hands.
And is there any significance to the blueness of the fingernails?
I would not have called these necessarily blue or cyanotic. That would be more of the discoloration of his face. There is some subtle blueness to the nail beds, which is again a sign of cyanosis, which is just reflective of a decrease in oxygen in the body.
And last photo is the
I wouldn't
BBS, please.
call it that, but I'm going to call it that.
What are we seeing here?
This image, Dawson is face up, and we can see his right and left legs. Here on his right lower leg, we see small bruises. On his right knee, left knee, we are seeing a bruise. And here is a site of medical intervention, the intraosseous catheter site.
And what are you able to tell us about the bruises on Dawson in terms of whether they're fresh or old?
They were all red and purple in appearance, so they were more recent.
Well, at least she's not making the noise anymore.
And based on your examination of Dawson, were you able to determine a cause of death?
Yes.
And did you determine that to a reasonable degree of medical certainty?
Yes.
And what was that?
Asphyxia.
Your Honor, I'd move to submit.
Oh, now we get it again.
Original photos of Cora and Dawson as for identification.
Right. Well,
And
that's
the other, the ones that were just shown to the
no
jury.
accountability.
Exhibits.
So mark the first set for identification. Right. Then over the defendant's objection, using the same analysis as stated in the sidebar, those other photographs may be admitted.
The photos of Cora and then Dawson as the next exhibits, please.
It's 228 and 229.
And then the, excuse me, that certificate of Cora, Renee Clancy as the next exhibit.
No objection to that.
Right. That may be admitted.
No objection to any of it.
Yeah, that certificate of Dawson, Renee Clancy as the next exhibit.
Why did she do
I have nothing further, thank you.
Mr. Rankin? All right. Thank you, Doctor. You may step down.
Thank you, Your Honor.
All right.
Now we're having a panic attack. Jesus.
Members of the jury, we're going to break at this time. I'm going to ask you to come back tomorrow at 9 o'clock. I would expect the schedule similar to what we had today. I'm going to remind you again, don't talk about this case. Don't read about this case. Don't read about any similar cases. Don't watch anything. Don't do any research. Put this out of your head for tomorrow morning.
Put this
All right?
out of your head.
See everybody
Right.
tomorrow morning. Thank you so much.
You just
All right.
put this out of your head.
All right. Well, the notebooks, please,
You autopsy dead children. Don't think about it.
this way, please.
Oh, stop. It's just on the TV.
Call this closing session.
Counsel, anything we need to address before tomorrow morning?
No, thank you.
So we'll be in recess on this matter till tomorrow at 9 o'clock. Thank you.
Court stands in recess. Please exit the courtroom.
Did you give her a hug? Go give her a hug. So he tells all the therapists, give her a hug. All right. Well, that's the end of the stream for today. I will be back tomorrow at 9 a.m. And we can do this shit show all over again. Anyway, thanks for coming. Thanks for joining me today and enduring this all with me. I appreciate you. And I will see you tomorrow at 9 a.m. if you show up. Till next time.
Man, club just a system, but the deck's set to fail. You speak for transparency, they call it a crime. Next day, you suspended for 6 months of your time. Pedigree, politics, trophies on the wall. Vanity awards while the ethics take a fall. They say it's for the free, but we know what it is. Power in the clubhouse, silence in the pit. Pedigree, politics, ribbons and lies. smiles at the banquet, but the truth in disguise. You can muzzle the voice, but the truth don't quit. Dog show, kingdom built on counterfeit grit.